Hello, I'm Jaleesa Lynn. I'm with the digital marketing team. I'm here with Dr. Sabnis, and we are going to discuss general surgery today. How are you doing today?
Great, thanks for having me.
Great, thanks for coming. And we got some questions through the Facebook comments. So our first question is, what are the benefits of minimally invasive surgery?
Well, minimally invasive surgery has many benefits. For some surgeries, it can actually decrease the amount of pain patients experience after surgery. It can decrease the chances of wound complications since the incisions are smaller, thereby decreasing scars. And in some cases, it can actually decrease the length of hospital stays to the point that there's no hospital stay and surgeries are converted to an outpatient surgery.
Great. And is there a chance that my gallstones will go away without treatment?
That's highly unlikely. Usually the treatment for gallbladder stones is actually cholecystectomy, removal of the gallbladder itself.
Okay. And how long does it take to recover from gallbladder surgery?
Typically, if a patient has gallbladder surgery that's done laparoscopically, patients can go back to a desk job within a week or two. And for patients who have heavy lifting, I would recommend that they avoid heavy lifting for about 6 to 8 weeks following the surgery, so they can probably go to light duty in about a week or two. It all depends on the patient.
Mm-hmm. And what kind of diet should I follow since I've been diagnosed with gallstones or gallbladder problems, or if my gallbladder has been removed?
Well, if you actually have gallstones and gallbladder problems, people should tend to avoid fatty foods or large fatty meals, as they can typically cause the gallbladder to contract and thereby stimulating more gallbladder problems and pain. Following gallbladder surgery or removal of the gallbladder, I advise patients to eat whatever they want and make attempts, as their body will normally adjust within about a month or two so that they can eat any foods without restrictions. Classically, patients are told to avoid fatty foods after gallbladder surgery, but that's a surgeon's preference.
Mm-hmm. And is gallbladder health hereditary?
Yes, gallbladder stones have been linked to family history. In fact, if someone has gallbladder stones, it is 4 times likely that first-degree relatives will also develop gallstones.
And what can I eat when everything causes pain?
Well, that's a tricky one. When everything causes pain, you should really see your doctor for an evaluation. A doctor would interview the patient, do an exam, and possibly do blood tests or recommend consultations to evaluate the cause of pain. This is not a good thing, and patients should be evaluated for pancreas problems. Their digestive tract needs to be evaluated. Their gallbladder needs to be evaluated. That might include CT scans and ultrasounds and endoscopy. But you need a workup if you're having pain with all the different kinds of foods.
Mm-hmm. And what are hernia symptoms and signs?
Well, first of all, a hernia is just a hole. It's a defect in the belly wall. And the first sign or symptom of a hernia is a bulge. A hernia that has a small bulge associated with pain needs to be repaired.
Okay. And is it possible to prevent a hernia?
While you can't, let's go back. A hernia, being that it's a hole or a weakness, you can't really prevent a weakness in the belly wall. And a weakness can lead to a tear or a hernia, or a defect in this case. But what we can do is we can minimize the abdominal pressures that would cause the weakness to develop into a hole. And the ways we can decrease abdominal pressures is to lose weight, stop smoking, exercise, dealing with chronic allergies and chronic coughs, so controlling your seasonal allergies, so the sneezing and the coughing, which adds pressure, can be alleviated. If you have chronic constipation, improving your diet, taking stool softeners, seeing a gastroenterologist if you're suffering from chronic constipation. And for the men who struggle with straining while urination, they need to have their prostate addressed before hernia surgery or before developing a hernia, because that can also cause pressure on the patient's abdominal wall.
Mm-hmm. And are there any medications used to treat hernias?
Since hernias are actually a physical defect or a hole, the only way to repair a hernia is actually to sew it up or patch it up. There is no medication that can treat a hernia.
Mm-hmm. All right, and this is from a patient. I've been having hernia repair surgeries for over 15 years now and need, again, another surgery. I'm so worried that this time they need to remove part of my bowel. What advice can you give me?
Well, again, this patient will need to actually, we would need to actually evaluate the patient and see what's going on. We can't really provide information or advice on what's going on with this patient in particular because we don't know the details of their situation. But when patients are having multiple hernia surgeries, it depends on what kind of surgeries were tried, what kind of techniques were done, what meshes were done, and what the complicating factors were. Again, obesity, history of smoking, wound infections, diabetes, these can all lead to hernia recurrences or the hernia coming back, and those things need to be addressed. Given that hernias are tears or holes in the abdominal wall, it's difficult to fix hernias because The abdominal wall is not a perfect bag. I mean, I view the abdominal wall as a container or a bag that holds the abdominal contents. And if that bag is weak, you can only patch it or sew it up so many times, but you can't replace it. And that is the challenge with hernia repairs.
I have an umbilical hernia after a surgery. A couple of years ago, it's giving me problems. Should it be removed? What's the recovery period?
An umbilical hernia or a hernia after surgery, we would call that an incisional hernia. We can't remove a hernia because there's nothing to remove. Given that hernias are holes or defects, the hernias can be sewn up or patched up. So if the hernia is causing problems, it should be evaluated by a surgeon. That might include a physical exam or imaging, and then the different modalities for repair can be considered.
Okay. Had surgery some years back for a hernia in my small intestines, and now I have this protrusion in my abdomen. Why and how to flatten it?
So it all depends on what this protrusion is from. If the patient had a hernia in her small intestines, we would call that an internal hernia, or a hernia between the different loops of small intestine. That's different from an abdominal wall hernia. So if this patient had surgery to fix that, that has nothing to do with the abdominal wall, but the actual act of surgery can have led to an incisional hernia. The protrusion should be evaluated by her surgeon, and that could be an incisional hernia that the patient's experiencing, or that might be just a laxity or weakness in the belly wall. If it is a hernia, it might need to be repaired. If it is not a hernia, then the advice would be different.
Okay. Let's see. I supposedly had a hiatal hernia repair done February 2016. It is bigger than before, as well as my abdomen is distended. I cannot vomit for some reason at all, and liquids get stuck in my esophagus and gag back out. Why? Can it be reversed?
So this patient had a hiatal hernia. A hiatal hernia is different from abdominal wall hernias. Hiatal hernias are holes or defects that are in the diaphragm that separate the abdominal cavity from the chest cavity. When a patient has a hiatal hernia surgery, typically there can be wraps done around the stomach. This could lead to the problems that the patient is describing with the nausea and the vomiting. Can it be reversed? It can possibly be revised. And I would encourage her to see her hiatal hernia surgeon to see what the problems are with that surgery. It should not cause a bulge in the abdomen, since the hernia is actually between the chest and the abdomen. It's within the patient's body and not protruding from it. So the protrusion is a little bit unusual. And again, I would encourage this patient to seek attention from her surgeon.
Okay. I had about 13 surgeries. On one of those surgeries was a same-day surgery. The doctor said that when they put gas in my stomach, that gas seeped under my skin, all over my chest and shoulders like air bubbles, and the nurses wanted to see it. The doctor said I was allergic to the gas, but I never had another episode except that one time. Will you please answer this question for me, because you work together with the anesthesiologist, and you know how long I should be asleep per surgery? Thank you.
So the gas I think the patient might be referring to is when we do laparoscopic surgeries, we do inflate the patient's abdomen, and we don't actually put the gas in the stomach. It's actually in the abdominal cavity, which is the area around the vital organs. The gas we use is typically carbon dioxide. So patients should not develop an allergy to carbon dioxide. Can the carbon dioxide seep into different parts of the body? In some circumstances where patients have other problems, the gas can seep into other parts of the body. But again, it would be a specific problem to that patient. The anesthesiologists use different gases to keep patients asleep and to maximize their comfort during surgery. That question would, I guess, be best answered by an anesthesiologist, because I'm not that familiar with the different gases the anesthesiologists use. But when it comes to the abdominal surgeries, it is carbon dioxide. It should not lead to an allergy, since it's in the atmosphere we breathe.
Right. My brother is having an aortic dissection repair surgery done. When rupture occurred in 2009, he was informed the repair could not be done. He wouldn't survive the surgery. Has this type of surgery improved this much? According to tests, it has become critical, and without the repair, the outlook is grim. He is a vet and will take place at the University of Maryland. Therefore, my question is, has the survival rate improved that greatly? There's an extremely difficult decision for us.
So when it comes to aortic dissections, this is usually the field of vascular surgery, and that's outside of the field of general surgery. but there have been great advances in vascular surgery, especially in endovascular repair, where small incisions are made. It's a minimally invasive approach to vascular surgeries. They make small incisions in the groin and access the blood vessels via wires and other devices, and try to do major surgeries through these small incisions. So there have been continued advancements in endovascular surgery, but I would encourage the patient to actually seek the consultation of an experienced vascular surgeon.
Okay, great. And I have one more question. I have what it feels like a knot above my belly button. Could that possibly be a hernia? I went to the emergency room because it was pain, and a couple of months back they did a CAT scan, but they said that there is nothing, but I know I feel something. Should I get another opinion?
Second opinions are always useful, and I would encourage the patient, when they are getting the second opinion, that they obtain the CT scan images on a disc to bring to their second provider, so that that provider has a chance to review the images, and it might actually save the patient another trip to a radiologist to get more imaging and more radiation. So I always encourage patients to get second opinions, especially if they continue to have problems.
Great. Well, thank you so much for answering our questions today, and thank you guys for tuning in. If you have any additional questions, you can leave them in the comment section below.